My name is Jean-Pierre Taschereau, and I have just returned from Guinea, where I was working as the head of emergency operations for the Federation of the Red Cross and Red Crescent. The action that we are developing on the ground aims to contain the outbreak of Ebola, and we're doing so through the national societies, essentially through four pillars of intervention. The first one is education, awareness, and community mobilization with the network of local volunteers who work at every level to spread Ebola-related messaging and get people to understand that this is a new disease and that they need to get medical assistance if they become infected with the virus. The second pillar of action is the containment through and prevention of further contamination through the management of dead bodies, supervision of burials, and disinfection of the houses and the health centers where people who were sick received treatment. We are also involved in contact tracing and surveillance so that when people are in close contact with someone who has a disease, that they can be monitored for up to 3 weeks, which is the incubation period, and that they can be moved out of the red zone or given assistance if they do develop the signs and the symptoms of the disease. Finally, our fourth pillar of intervention is psychosocial support, not only to the people who have survived the virus and their families, but also to the volunteers and the health staff in general, who unfortunately are often stigmatized because of the fact that they're working with the disease, and people in their communities not knowing what they're really up against sometimes tend to stigmatize them and move them away. So this, in short, is the work that we're doing through the national societies, but also through the work of delegates that we're deploying from all around the world as part of the movement.